Before we begin today's symposium, I would like to acknowledge the traditional owners of the traditional custodians of Australia, and specifically the Gadigal people of the Eora Nation, upon whose lands the University of Technology, Sydney City Campus stands. I would also like to respect elders, both past and present, and recognize their valuable and ongoing contribution to the society. And as we gather virtually, I would also like to extend this respect to the traditional custodians of the lands on which each of you are joining us today. Hello, and welcome to everyone joining us from across the world. Whether it's morning, afternoon, or evening where you are, we are really thrilled to have you here today, and a warm welcome to the inaugural symposium of the Global Practice Initiative. It's a great honor to open this event, which brings together participants from across the world to explore a critically important issue, the role of nurses in influencing the upstream social determinants of health and advancing equitable healthcare practices globally. Nurses are the backbone of healthcare, not only in their clinical work, but also in shaping policies and practices that address health disparities and promote equity. Today, we gather as a global community to learn from each other, share insights, and amplify the powerful influence that nursing can have in transforming health systems. This symposium is a testament to our shared commitment to improving health outcomes for everyone, no matter where they are in the world. And I'm really excited about the conversations and collaborations that's going to take place today. I want to thank each one of you for being here today, especially our esteemed speakers and panelists and the Global Practice Initiative team. Now, I'd like to introduce the Global Practice Initiative team led by Dr. Natalie Cutler, who spearheads this project as a lead researcher, and with Dr. Albie Sharp as the co-lead. Dr. Natalie Cutler, senior lecturer at UTS, leads innovative mental health, nursing, and global health programs, and facilitates international study tours to foster cross-cultural learning. Dr. Albie Sharp, co-lead of this project and senior lecturer at UTS, specializes in public health and the social determinants of health, with a focus on non-communicable diseases and global health security. Distinguished Professor Tracy Levitt-Jones is a world-renowned researcher in planetary health, empathy, and patient safety, and she has authored numerous influential works in nursing. Dr. Mohammad Chutiami, lecturer at UTS, is an expert in community health and infectious diseases, contributing extensively to global health research. As for myself, I'm Dr. Priya Sarvanakumar. I'm a gerontology researcher and senior lecturer at UTS. My research focuses on older adult well-being, particularly culturally and linguistically diverse populations. So today's program, before we get into today's sessions, I would like to go over a few housekeeping rules to ensure that we have a smooth experience, all of us. So the microphones, I believe, are being controlled by our team. Please feel free to keep your cameras on if you're comfortable. However, if your connection is a little bit tricky, turning off your camera might help with the quality of your engagement. If you experience any technical issues, please do put in our chat box. So our support team is here to assist you. And to all our dear speakers, when you're nearing the end of your allotted time, you'll see my camera background changing. A green background means you've got 2 minutes remaining, yellow, 1 minute left, and red means your time is up and you'll have to wrap up your presentation to keep us on schedule. Now, we are using Slido for questions today in the symposium. So if you have any questions for the presenters or panelists, simply head to Slido using the QR code provided in here. You can take a picture and get into the link. You can also upvote questions from others, and we'll aim to answer the most popular ones during the Q&A sessions. And a reminder to everyone, This is a code for submitting QR code, which will take you to the place where you can submit case studies. Please ensure that you make your case study submissions through this link. And if you have any questions about the submission process, please get in touch. You can put in a chat message. I also encourage everyone to follow our Global Practice Initiative Facebook page, where we'll be sharing updates, resources, and ongoing discussions after the symposium. It's a great way to stay connected and continue the conversation. And to help us get to know each other, it'll be great if you all could take a moment to introduce yourself in the chat, or the region from where you're joining. Yeah, please feel free to react with an emoji or a short greeting from your region. Lastly, don't forget to register for our upcoming regional symposia. These events will offer deeper dives into the topics that we're discussing today, but will focus on specific regional challenges and opportunities. So we've got 3 upcoming symposia in November and in November and December. And please watch out the website for the dates and the times. Now, I would like to invite Dr. Cutler, Dr. Natalie Cutler. Dr. Natalie Cutler is a senior lecturer at the University of Technology, and she's a leading voice in international health initiatives. She has a wealth of experience in mental health nursing and global health, coordinating international study tours for nursing public health students through the New Colombo Plan. With a PhD in nursing from the University of Wollongong and a Master of Public Health from UNSW, her work focuses on enhancing mental health and nursing globally, with a particular emphasis on addressing social determinants of health. Natalie, thank you for your leadership in this project and for joining us today. Over to you for your presentation.
Sorry, Natalie, we can hear you.
Lovely. So can you see my slide correctly now?
Yeah.
Great, thank you. Well, hello everybody. Just absolutely delighted to be here with you, and what a wonderful session we're in for today. The first of many, we hope. So as Priya's introduced me, I won't do that again, but suffice to say that I'm one of a number of people who are involved in this project and initiative, and this initiative is really occurring by virtue of the World Universities Network. We had an idea, as occurs, we had a collective idea, and we tried to make that idea come to reality, and we were able to do that with the funding that we received through the Worldwide Universities Network earlier in the year. And so to be standing here now speaking with you and seeing that idea from such a while ago come to reality is really remarkable and very, very exciting, and a real privilege. So I wanted to acknowledge the World Universities Network, particularly as they have a focus on bringing partner universities together and fostering an international research collaboration that is directed specifically at problems of global significance, and nurturing early career researchers in that, and giving opportunities for some of those early career researchers to start to have an impact and make a difference. So yeah, really proud for our team to be funded by the World Universities Network. And we have a lovely team of partners from other World University Networks and non-WUN universities as well. So I wanted to acknowledge them. Some of them might be with us today. Colleen Norris from the University of Alberta, Julia Slark from the University of Auckland, Professor Walalik Pampung and Dr. Warit Tanoi from Hidal University in Thailand, from the University of Leeds, Professor Sonia Kumar, and from the Universitas Indonesia, we have Assistant Professor Henning Pujasari. And thank you very much for our guest speaker, Koiru Zhao, who's going to speak shortly, Distinguished Professor from Taipei Medical University. And finally, we have Dr. Mustafa Adam Kolo from the University of Maiduguri. I hope I said that correctly, Maiduguri, in Nigeria. So those are our university partners, and we're so proud to be working together to bring this forum to you. So my presentation is called Navigating Upstream, and looking at conceptual models to inform thinking around upstream social determinants of health. And I love conceptual models, and I particularly love them because they are so, they generate a different way of thinking and engaging with a particular way of thinking or understanding something. And so we, Professor Chow, who's going to be speaking shortly, presented to a forum at the Universitas in Indonesia 2 years ago. And I and my colleague Albie were there, and we listened to Professor Chow's presentation, and what she spoke about really touched us and really inspired us to start thinking about what role nurses have at the upstream level of social determinants of health. And that term upstream isn't always widely used or widely understood. So I went in search of some conceptual models to help demystify that. So here is one. Now, this is not a nursing model, but I will, you can see that it's a very structured model, that it has a continuum from downstream to upstream, and it becomes sort of more related to the social conditions than individuals. So that's what we would expect. And so the further away from the individual health and towards the population and global factors, that it becomes, more upstream. So there's no real, it's a continuum, so there's no real defining line, and that's what I've found in trying to search for a conceptual model that gives a definitive representation of upstream social determinants. There isn't one, and that's really okay, because that allows fluidity and space, and also for new ways of thinking to occur. So so this is one model that I think is a very attractive model and very visually engaging, and it does tell an interesting story. This one was designed by a regional health service, so it's actually for a local setting, but you can see so easily how relevant it would be for a larger context. And then beyond this, I saw this is possibly close to my favourite conceptual model representing the upstream social determinants of health, and I think you can see why. It's a pretty neat and clean and clear representation of what might be considered, downstream, midstream, upstream. This model does have little sort of distinctive segments, nominally, but it also represents a stream. So there's also going to be flow between those different segments. And as you'd expect, downstream is about the individual impact, midstream is at that neighbourhood level, and upstream is at the community and the impact that it can have on that interventions have at the community level. The thing I also like about this model is that it divides on each side. You've got the strategies and you've got the tactics, and I absolutely love the use of the word tactics because it's unusual, it's novel, and it draws you towards it and makes you wonder, what does that mean? And so the strategies are what you need to do, and the tactics might be how you would do that. So the thing about conceptual models, I think that's really useful too, is that it does it allows you to interpret and to make meaning out of something for yourself, and to you can, the more you look at a conceptual model, often the more you see. And the reason that I'm sort of presenting it so early in our discussion is to contextualize what we mean by upstream, and to also let you know that there isn't one definitive definition, but that is also okay. Now, another model that I came across, and many of you might know this model by Fawcett and Ellenbecker, which was developed published in 2015, and it's called the conceptual model of nursing, or as Jacqueline Fawcett calls it, a nursology. So Jacqueline, considers that as a specialty discipline, nursing, and that has its own body of knowledge, that we actually, she much prefers and uses, assertively uses the term nursology. And the more that I read it, the more interested and likely I am to start using it myself, because I think it's resonant, and it's also got, I mentioned the word tactics being novel, and I think it's also novel, and novel things tend to bring people toward them and draw them and interest them and engage them. So I think that's a feature that I'm flagging for future conversations about how do we engage, you know, people around thinking about nurses' role at the upstream level. So sort of hold some of these thoughts for our later conversations. But this is quite a rich model, as you can see, and it's really very much focused exclusively at the upstream level. And you know, but even considering things like genetic factors, which would, you know, potentially traditionally be considered at a downstream level, is you know, she's seeing at a broad population level that's an important thing to be factored in and considered in terms of healthcare and approaches. So that the healthcare system, the systemic factors, the environmental factors, and then looking at wellness burden, functional status, life expectancy, all of the classic indicators of outcome. And then I really love this section down the bottom left where she's talking.
Pardon me, Natalie.
Yeah.
I'm really sorry. The time is up. I just wanted to alert you.
Right.
Yeah.
All right. Well, let me flick my images through, because you'll see, if you want to know more, you can come to me. This is a beautiful model. This is an interesting model. This is a gorgeous model, and so on. And these are some student models to consider. So, oh, there you go. I was worried that might happen, but it did. And but I will be around for conversations later. But thanks for your attention. I hope that at least started your thinking.
Sorry. I'm sharing my screen here.
While we're waiting, were there any questions? Oh, here we go. That's okay.
Is everyone able to see my screen?
Yes.
Yep, great. Thank you very much, Natalie, and I'm sorry that I had to, be the reminder.
It was definitely my fault.
Now, I would like to introduce Professor Chow. Professor Chow is a globally renowned leader in nursing and healthcare, currently serving as a distinguished professor at Taipei Medical University in Taiwan. She is a fellow of both American Academy of Nursing and the Faculty of Nursing and Midwifery at the Royal College of Surgeons in Ireland. Her contributions to the field have earned her recognition among the world's top 2% scientists, as ranked by the Stanford University. Among her numerous prestigious accolades, Professor Chow was included into the International Researcher Hall of Fame by Sigma Theta Tau International, and in 2023, she received the Taipei Medical University Research Excellence Award. She's also been honored with the Lulu Wolf Hassenplug Alumni Award from Vanderbilt University for her outstanding contributions to nursing research and leadership. We're truly privileged to have such an accomplished expert as a keynote speaker today. Please join me in welcoming distinguished Professor Hiru Chow.
Thank you, Dr. Priya, for your wonderful introduction. Let me share my screen to every one of you. Okay, greetings from Taiwan. It's really my great pleasure to be here with you today to have a conversation on the topic of challenges and future prospects in nursing and healthcare. And healthy people in 2030 has an increased focus on social determinants of health. According to WHO, determinants of health can be divided into 3 categories. The first level is individual lifestyle factors, such as age, genetic factors. And the second level is social and community network. And the third level is general social, economic, political, cultural, and environmental conditions. Can you hear that? And the vision for nursing This framework is outstanding. It's according to the National Academies of Sciences and Engineering and Medicine in 2021. This framework highlights critical areas to strengthening nursing, including workforce, leadership, education, well-being, and emergency preparedness. We nurses, we are the key in addressing both medical and social determinants of health. And during the evolving challenges such as demographic technology care models and public health emergency changes are those issues we need to ensure policy and regulations support nursing evolving role in healthcare. What I would like to present the first part of my presentation is talk a little bit about key areas that's gonna impact on nursing. These are the key areas that will impact on nursing into the future. The first is demographic change. Based on this picture, you can tell the aging population as of 2022 can vary a lot, especially in this red area. So many nations have already entered a period of negative growth, with over 21% of their population classified as elderly, making them into super age society. By 2050, the global elderly population is expecting to surpass 1.5 billion. We are facing national security crisis right now. Next, I would like to discuss genetic and lifestyles that may impact on nursing. From this picture, over the past 20 years, the growth of chronic disease has far outpacing population growth rate. Average in the past 20 years, population growth rate is 20%. However, conditions such as cancer, 62% increase, mental health, 54%, and diabetes, 53%, has outrageous growth outpacing our population growth rate. And how much do countries spend on health? Actually, the health costs vary significant across countries, range from 4.3% to almost 17% among OECD nations. In recent years, the focus of healthcare spending especially shift to outpatient services and long-term care costs. Based on the demographic aging society and genetic change, it is required to restructure the healthcare systems. Our healthcare system is composed of several parts, especially from preventive care services to acute care, post-acute care, and to rehab services. Now, new approaches are needed in the future. The long-term care services cover the spectrum across the various stages, from health, frailty to disability, dementia, or even to the end of life care. Services need to include community care, dementia care, home services, and institutional care, all aimed at providing comprehensive support throughout the aging process. Now we take a look at the education impact on nursing, and you can see the flexible system in the United States allow nurses to progress through various education levels from LPN to DNP or PhD, contributing to the diverse and highly skilled workforce. And APN accounts for almost 12% of US nursing workforce, and APN including NP, CNAs, NA, and nurse midwiferys. And NP represent the largest group, accounting for almost 70%. And currently, there are around 400,000 NP licensed in the United States. Family NP is the largest group, account for almost 70%. However, here in Taiwan and also in the whole world, we need to create more curricula for nurses in the gerontology NP and the mental health NP. In 2006, AACN endorsed the task force on the roadmap to the DNP. Therefore, DNP programs have significant growth in the United States since 2006. There are currently almost over 400 DNP programs. And this growth reflects the increasing demands for the doctor-prepared nurses to lead in clinical practice, research, and healthcare policies. Next, we will discuss workforce impact on nursing. Currently, there are around 28 million nursing staff in the whole world, accounts for almost 60% of all healthcare professionals. The majority are professional nurses. According to OECD report, the number of nurses per 1,000 population varies a lot. Range can from almost 19% in the Switzerland down to only 1 per 1,000 in South Africa. The average is 9 per 1,000, indicating the needs for strategic workforce planning in healthcare system. And let's take further look at the turnover rate. In the United States, the turnover rate recently has increased from 15% to 27% in 2021. Each RN turnover costs an average of almost 60,000 hospital losses annually. And we know the recruitment difficult index in the recent years is extremely increased in the United States, especially in the critical care unit. The average time to recruit an experienced RN is around 90 days. Before pandemic, WHO addressed there are about 6 million nursing shortage. After pandemic, ICN estimate there is a shortage of 13 million nurses in the whole world. WHO recommends increasing the number of nurse graduates by 8% annually. The last key that we are going to address is technology. Technology is one of the fastest developing areas of healthcare in the whole world. The evolution pathway of healthcare technology starts with community alarm, to telecare, to APP, to big data, and to robots, etc. In summary, here are different challenges for the global nursing healthcare, including aging population, nursing workforce shortage, disparities in nursing education, fragmented healthcare models. Without appropriate strategies to overcome the barriers, it could turn into a vicious circle for all of us. Therefore, it's important to address the issue of a vision for nursing toward global challenges. To achieve our vision for nursing, we must take decisive action to engage in health and social policy, to amend the legislation and regulation, to expand our nursing education, to extend nursing care model, to work shift and transform nursing through technology. First, let's talk about health and social policy. We nurses, we must actively engage in policy making to advocate for changes that improve healthcare system and patient outcome. As we all know, WHO has identified a roadmap to improve global health and well-being by 2030. This plan is built up on 6 pillars: leadership governance, healthcare financing, medical product technology, information, and robust health workforce. In addition to that, WHO has identified key policy priorities, include investing in health, addressing major health challenges, strengthening public health, and building our resilient communities. These priorities aim to strengthening global health systems. Our action too is we nurses, we need to outline the current and proposed legislative and regulative framework that guide nursing practice, to expand our nursing scope of practice. And also, nursing practice must evolve, especially through updated legislation and regulation, expanding the scope of practice, particularly for nurse practitioner and other advanced nurses' role. We, nurses, we need to remove scope of practice barriers. We need to expand opportunities for nurses. In 2017, Elizabeth Iro was appointed as the first CNO, Chief Nursing Officer at WHO, marking a turning point for nursing leadership in global health policy. She identified nurses play a critical role, not only in delivering care, but also in shaping health policies and advocating for universal health coverage. We need to actively advocate for policy change. We need to engage in policy making. We nurses need to value nursing leadership because nursing leadership is important for advocating for policy changing. Nurses must lead at all levels. We can lead from self. We can lead to others. We can lead to healthcare and even beyond healthcare systems. We need to expand and promote nursing education. Nursing education must evolve to include new competencies, such as health policy, adapting new technology, and disaster preparedness to handle complex healthcare environment. In order to meet healthcare demands, it is important to increase the number of nurses with higher degrees. This includes upgrade our basic nursing education to the BSN level, to expand post-baccalaureate nursing program, and growing the number of master and doctor prepared nurses. According to AACN, by 2030, the goal for nurses with BSN will reach to greater than 80%. We also need to expand post-baccalaureate nursing program, doubling the number of nurses with doctor or master degree by 2030, because we believe salaries, benefits must be reflected for doctor prepared nurses. We need to conduct more researches to highlight the value of nursing profession by the use of evidence-based nursing research to speak for us, to speak for the power of nursing. During the rapid growth of digital learning, we have a profound influence on nursing education. We need to embrace digital tools to prepare our nurses for the future of healthcare in the evolving digital world. New and emerging models of nursing care are not limited to acute care anymore. We now need to extend to prevention and management of long-term care conditions to meet the evolving needs from hospital care to overall wellness of the population. New care models such as telehealth, nursing-led clinics are helping to increase access to the care for the future. With regard to employment and workforce shift, The WHO identified we need to aim to optimize healthcare workforce policy and provide effective public policy, leadership, and governance to improve healthcare worker distribution and strengthening monitor HR data nationally and globally. Next, transforming nursing through our technology. Future of nursing involves digital healthcare chains, including virtual care, big data. Nursing need not only traditional tool, but also robotic assistant to reduce our physical and mental burden. The spectrum of technology nursing care, from telecare to virtual nursing, is going to embrace in our future of nursing. Overall, there are many drivers for change. Patient redefine, workforce shift, new integrated care model, digital device, and big data. Here's the summary for the vision of nursing towards global challenges. Society is changing. Health social care is changing. Technology is changing. We have new roles and responsibilities. We need to prepare nurses for future needs and roles. Investing in education, investing in nursing and long-term care, investing in workforce, investing in leadership. Let's create the future together. In the era of challenges, there are so many choices, and we do believe we have a chance to make such a huge change for nursing. Thank you.
Thank you very much, Professor Chow, for that very insightful and inspiring keynote lecture. Your contributions to the field are truly remarkable, and we are very grateful for your time today. Now, we'd like to open the floor for a Q&A session. Let me share my screen. Yeah. So if you could please submit your questions to Professor Chow through the SDoH app, or feel free to post them directly in the chat. Yeah, we'll be able to get the questions. Yeah. Dr. Chuti, will you please be able to? Yeah, Dr. Chuti will be able to moderate for this session. Thank you.
Thank you so much, Dr. Priya. And yeah, considering the time, we're gonna go only through a few questions for Professor Chow. So going from the chat area, we have got a question that says, can you share an example from your setting that explains the application in real world nursing practice? So probably the person is referring to the application for the social determinants of health, I assume.
You mean share an example for that?
Yeah, I share an example from your setting that explain the application of or how nurses can contribute to the social determinant of health in practice.
Let me share my screen for that model first, and I will share the example to every one of you.
Thank you so much.
Yeah. Yes. Now, as you can see from this framework, a vision for nursing framework. And in my country, especially in Taiwan, actually, we are doing so many strategic plans to improve to strengthen nursing for the future, especially for the leadership. We establish a lot of programs for leadership training at different levels for young generation nursing leaders, for advanced senior leadership training program. based on different kind of leadership training program, we have so many outstanding leaders become the success leader in the future. And for the education program, currently we have established different kinds of a PhD program. We have DNP as well as the PhD blooming in the last 10 years. And especially for the emergency preparedness, we also trying to improve our emergency preparedness as the central issue across almost over 100 hospitals currently here in Taiwan. And we have so many strategic plans to improve our workforce for nursing. First, without enough workforce, then we are closing the beds because we don't want to reduce the quality of care for nursing. We have so many incentives trying to to recruit more outstanding graduates from nursing field into our clinical practice. And that's the key areas for us. We pay a lot of attention for that. And nursing right now, we have so many nursing leaders to service in the very important position for the whole country, that we can focus on our policy making and also trying to change the regulation that's out of date. And that's a very good example. That's why we're trying to change the payment system currently for nursing practice as well. And during the evolving chain, we pay attention. Right now, we have so many advanced care model in Taiwan as well, trying to update it for the aging population. We also prepare so many updated technology for us, trying to when we're facing the aging population today. And those are the issues and a very good example that we adapt from this framework and try to improve the nursing practice for the future. Thank you.
Thank you so much, Professor Chow. That was a great response. Another question we have is, given the demands on nurses in terms of workload and responsibilities, is it realistic to expand nurses' scope of practice to include work around social determinants of health?
Yes.
Yeah.
Yes.
It's a
My
tricky
answer is
question.
yes. I'm sorry because when I mentioned in my presentation, the scope of practice, especially, is extremely important for the advanced nursing role. For example, the prescription right. Without those rights, we have only limited power and limited resources for us to practice in the community. However, nursing's role need to be expanded because our future for our population change is we have to pay attention on community service. Therefore, we need to protect, to have extended a scope of practice for those nurses to service in community in mental health. That's why we definitely need to expand more critical role for nurses in nursing practice. Thank you.
Thank you so much. And quickly, the next question says, in Nigeria, new policies are adopted, e.g. task shifting and task sharing policies. What is your opinion on this?
I beg your pardon, sharing policies?
Yeah, so there are policies around task shifting and task sharing.
Okay.
So what is your opinion considering
You mean
the work of nurses around social determinants of health?
Workforce shift. If our workforce still focus on acute care, then we ignore 70% of the aging population in the society. So that's why we need to shift our workforce into community. I know it is not okay right now because the majority of workforce in the acute care is still not enough. However, if we did not shift that, that means we need to incorporate with technology to service in the community. Without doing that, we are not providing enough space for service for our people who need us in their community. That's why workforce need to shift a little bit from 70% in acute care to community service, because the majority of our patients may not be focused on acute care anymore.
Yeah.
We need to redefine our patient. Our patient will include a lot of proportion. They're located in the community. Okay, thank you.
Lovely.
And can I add something to that, Shudi? Just quickly,
Sure.
because there's that other type of shifting of the roles that are not nursing, shifting some of the tasks that are currently healthcare workers do to non-healthcare workers, so that you expand the capacity of the community to provide care for itself in a way. So that's another type of shifting that is probably more than we can discuss today, but it has implications for workforce, I guess.
Thank
Lovely.
you, Natalie.
Lovely. Do we still have time, Priya, to take one or
know,
two more questions?
I think we have to move on, and then I think we can take questions in the following
Okay.
sessions.
So
Yeah.
sorry for the others. We will take more
Mm.
questions at the end of
Yeah.
the program. Thank you so much,
Thank you.
Professor Chow.
Thank you very much, Professor Chow, and thanks, Dr. Mohammad Chuti and Dr. Cutler.
Thank you.
I'm just going to share my screen briefly for our next speaker. Is everyone able to see the screen?
Yes, thank you.
Yeah. Next, I'm very excited to introduce our own distinguished Professor Tracy Levitt-Jones, who will be presenting on climate change, the greatest threat to public health in the 21st century. Professor Levitt-Jones is a globally recognized leader in nursing research, currently serving as distinguished professor at the University of Technology, Sydney. She leads the Planetary Health Collaborative and the Empathy Initiative Research Group, and she is ranked among the world's top 1% of nursing scientists by the Stanford University. Her extensive program of research includes work on planetary health, empathy, and patient safety. She has authored several books, published over numerous journal articles, and secured more than $7 million in research funding. Professor Levitt-Jones has also been honored with numerous teaching and research awards, including her induction into the Nurse Researcher Hall of Fame in 2022. We're incredibly privileged to have her here today to share her insights on this critical issue. Please join me in welcoming Professor Tracy Levitt-Jones.
Thank you, Priya. I think Natalie's going to share her slides, my slides, for me.
Sure.
Thank you. Natalie, do you want to just put that on to presenter mode? Or full mode, that's it. And can you? Perfect, thank you. It's lovely to be part of this exciting symposium this morning, and I have really enjoyed the last presentation. It gave me so much food for thought. So what I'm going to be talking about is climate change. The World Health Organization has described climate change as the greatest threat to public health in the 21st century. Climate change is an upstream determinant of health. It's also a socially and politically modifiable determinant of health, and one we have to focus on. Next slide, please. Our planet is in trouble, but we don't need more debate, procrastination, denial, or political handballing. The science is clear. Our world is warming. It's due to human activity. The warming is having a severe impact on human health, but we can do something about it. And as nurses, it's time that we stepped up and took responsibility to address the climate crisis. We need nurses in all the nooks and crannies of healthcare, in research, education, advocacy, and practice, to lead both in climate change mitigation and adaptation. Next slide, please. I'm sure some of the slides I'm showing you now they come from the media and you'll be very familiar with them. This one, heatwave claims over 1,000 lives as temperatures hit 51 degrees in Mecca. 2023 temperatures were the highest on record across the world. The thing to remember is that the people most affected by heat waves are the most vulnerable. Older people, children and babies, pregnant women, outdoor workers, people with mental health conditions such as schizophrenia, people with cardiovascular and endocrine diseases, people who are homeless, who have insecure housing or poor quality housing, or don't have air conditioning or can't afford air conditioning. These are the people most vulnerable to heat waves. Next slide, please. You may have seen the media speaking about severe floods that are ravaging East Africa. In some ways, we're almost becoming immune to the extreme weather events being brought about by climate change. What we need to keep in mind is that low resource countries who produce the least global emissions are the ones most impacted by the high emissions of countries like Australia and other high resource countries. And it's the low resource countries that had limited infrastructure and ability to be resilient to these extreme weather events. Thanks, Nat. In Canada, record wildfires have spread to urban areas and led to internal displacement of thousands and thousands of people. And currently, there's still 230 fires burning across Canada. And thanks to fossil fuel-induced climate change, the wildfire season in Canada, North America, Australia, and other countries are becoming hotter, longer, and more unpredictable. The burning of these vast tracts of forest are polluting the atmosphere, not just in Canada, but thousands and thousands of kilometres away. And the emissions will have tripled Canada's emissions this year. Next slide, please. There are also severe droughts in many countries, and millions face hunger and water shortages as extreme droughts sweep through southern Africa. And in fact, 24 million people in southern Africa are facing hunger, malnutrition and starvation due to the droughts, and this is creating an unimaginable humanitarian crisis. In high resource countries, we can afford to buy food, even when the cost of food is exorbitant. But in low resource countries, droughts and floods make the purchasing of food almost impossible and lead to severe malnutrition and starvation. Next slide, please. The disease burden of air pollution on children continues to rise in Bangladesh and other related countries. A UNICEF report has identified alarming trends in air quality in Bangladesh, India, and across South Africa. And in 2023, in Bangladesh alone, there were over 235,000 deaths in Bangladesh, with 700 of these being related to being children under 5 years old, who are especially vulnerable, with health effects including prembirths, low birth weight, asthma, and lung disease. The life expectancy for people living in Bangladesh, India, and some other countries in Southeast Asia has been reduced by 7 years because of air pollution. And across the world, it is anticipated that all of our life expectancies will be reduced by at least 3 years because of air pollution and other forms of pollution, such as plastic pollution. Next slide, please. Deforestation also has devastating consequences, including social conflict, extinction of plants and animals, and climate change. Logging, mining, and farming in tropical forests displaces Indigenous communities, and left without land or other resources, native cultures often disintegrate. Deforestation leads to biodiversity loss, and vector-borne diseases proliferate. Climate change and habitats expand the range of disease-carrying insects, increasing the prevalence of malaria and Lyme disease. And ecosystem disruption affects food security and increases the risk of zoonotic diseases carried by bats and rats, for example. 50% of chemotherapy agents, statins, and antibiotics come from fungi and bacteria. And when we have deforestation and biodiversity loss, what we are actually doing is reducing our ability to create future medications that we're going to need. Next slide, please. Rising sea levels damage food sources and ancestral burial sites in the Torres Strait Islands. And the Torres Strait Islanders are among hundreds of millions of people across the world who are at risk of being displaced by rising sea levels caused by climate change. Next slide, please. Now, we often think that climate change is disproportionately affecting low resource countries, and it certainly is. But there are also low resource people living in high resource countries. So I'm going to tell you the story now about two families from Australia. On the left, we have the Murphy family. Charles, a GP, a general practitioner, Alicia, a high school teacher, and their children, Elizabeth and Finley. The Murphy family live in a new brick home. It has double glazing, it's well insulated, and it's powered by solar electricity, and they have ducted air conditioning. Both Charlie and Alicia drive electric vehicles. Charlie has a history of hypertension, but he's on antihypertensive medications, and he maintains a healthy lifestyle through his home gym and swimming laps at the local pool. Alicia considers herself to be an environmentalist, and she coordinates the local community garden. Elizabeth is in Year 10 at an Anglican girls' high school. Like her mum, she's passionate about the environment, so much so that she's experiencing climate anxiety, but she's able to see a psychologist at least once a month. Finley has mild asthma. It's well controlled, he's able to play soccer, and he sees his doctor regularly. He has a good asthma management plan, and he takes reliever medications. Now, on the right, we have the Ellis family. They live less than 500 metres from the Murphy family. The Ellis family includes Jill and Damien and their children, Abby and Luke. Until recently, the family lived on their own 4,500 hectare cattle property. Despite droughts and floods over the years, they managed to stay financially afloat and were healthy and happy. Until 6 months ago, severe storms and heavy rains hit, resulting in unprecedented flooding of their property. The previous floods had never reached as high as the equipment sheds or the stables or their home. But on this occasion, the river rode with such intensity, and within 24 hours, it was at a level they had never seen before. The family lost more than 3,000 cattle, most of which died in the paddock or were washed away. These cattle were the result of a breeding program established by Damien's great-grandfather nearly 100 years ago. The insurance company continues to dispute their claim, saying they weren't covered for storm surges. Their house can't be lived in, and they don't have the money to renovate. So the family has moved into town so that they can work and try to pay off all their debts, farm debts. A family friend offered them a home to rent at a good price, but warned it's pretty run down. He doesn't intend to invest any money into maintenance, as he plans to knock it down and rebuild soon. There is no insulation, it has rising damp, and the air conditioner does not work. Matthew is now working as a labourer and a delivery driver after hours because they still have a big loan on their farm. He gets worried, though, about how long his car will last. It's a 1998 Land Cruiser. It's done a lot of kilometres. The air conditioner has not worked for years. Matthew also has a history of hypertension, but he hasn't had time to have a checkup. His prescriptions have lapsed and he's not taking antihypertensive medications at the moment. Jill works as a teacher's aide. She also does some casual cleaning jobs. On weekends, she works in a coffee shop. She misses the large vegetable garden she had on her farm, and she thinks the fruit and vegetables at the local supermarket are exorbitantly priced and of poor quality. Abby desperately misses her friends and schools. She can no longer compete in equestrian events as her horse was killed in the floods. She's struggling with anxiety and depression. She's on the wait list to see a psychologist at the public hospital, but she's been told that it could take 9 to 12 months to get an appointment. She does see her counsellor, school counsellor, occasionally.
Apologies, Tracy. I'm sorry. Apologies, Professor Tracy. Time
time. Oh, sorry, Priya, I didn't see the colour come up. All right, so I'm just going to go on to our next slide. Our call to action. A reminder that healthcare produces 5% of the world's carbon emissions, and nurses form the largest group of healthcare professionals, nearly 30 million. And we are trusted, given the expected increase in climate change impacts on human health. Current and future nurses must be able to respond effectively. Next slide, please, Nat. Last slide. So we must keep learning as much as we can about climate change and planetary health. We must speak up. We must embrace our political power and vote responsibly. We must practice and live sustainably in our work and in our home lives. And we must collaborate with others, other nurses, other healthcare professionals, and people outside of nursing and outside of healthcare to address this huge issue. Oh, sorry, last slide. We have to consider the legacy we're passing down to future generations, and together we can create a healthier planet. And really, the health of humanity depends on the health of our planet. As guardians of health, it's our duty to lead the way in this crucial fight. Thank you.
Thank you very much, Tracy. I'm sharing my screen. Yeah, now over to Dr. Albie Sharp. I would like to introduce Dr. Sharp, who is a co-lead of this initiative and a senior lecturer at UTS, specializes in public health and social determinants of health with a focus on non-communicable diseases and global health security. Today, Dr. Sharp will be presenting on the UNICEF HCW model in practice, implications for nursing. Please join me in welcoming Dr. Sharp.
Okay, thank you very much, Priya, and everyone, and all of the speakers that have set this discussion up so well. I think that's really important. Thanks, Priya, also for the promotion. I'm actually just a lecturer still at the moment, but certainly working my way there. All right, so I'm speaking to you today from Turrbal Aboriginal Country in Meanjin. I'm attending another symposium at the moment as well, so I'll be rushing off there after this. But I wanted to say that I really hope that the excitement that we feel about this project is infectious, and we really believe that this project has the potential to transform the way we think about professional practices in health. So today I'm going to talk about the UNICEF Strategy for Health 2016 to 2030. I think it provides a really useful counterpoint to the models developed by Fawcett and Ellenbecker that Natalie touched on a little earlier. And I was also really mindful while Professor Chow was speaking of how well this model applies to the vision for nursing that she set out so eloquently. I should also point out that I do not work for UNICEF, and the model and the examples that I'm presenting today are the result of a desktop review of UNICEF planning and evaluation documents, although I'm really interested in following this up further. The model itself, the UNICEF model, which you can see on your screen to the right, can be applied to our project by providing pathways for action around the upstream social determinants of health. The program of action developed by UNICEF is primarily aimed at community health workers, not specifically nurses, although community health workers is a really broad label and certainly does include community nursing and community health promotion and promoters and community health volunteers as well. Firstly, I'd just like to point out the three approaches towards the top of the table: the need to address inequities in health outcomes, strengthen health systems, and promote integrated multi-sectoral policies and programs. All of these can be really interlinked with the upstream social determinants. They provide a really good range of intermediate goals that we can aspire to achieve through our work. However, it's the actions underneath these that I think we are primarily interested in today. So these actions are grouped into advocating for every child's right to health, influencing government policies, strengthening service delivery, and empowering communities. So just as a case study, I'm going to focus on the Kenya WASH program. That's the Water, Sanitation and Hygiene program, which was delivered by UNICEF and over the past decade or so. And I'm going to consider how the UNICEF strategy actions have been employed. So the UNICEF documents are really helpful in providing a detailed upstream social analysis and the interlinkages between those determinants. The UNICEF model is also really useful in working across a range of different settings, different income and resource levels, from emergency situations through fragile and low capacity to medium and high capacity countries and regions. Just as background, the UNICEF Kenya WASH program aims to improve access to clean water, sanitation and hygiene in some of Kenya's most underserved communities. The 2017 Kenya situation analysis showed how WASH is central to improving health outcomes, with poverty, housing and education acting as interconnected factors. And these are really explicitly set out in the UNICEF documents. But these upstream determinants themselves are interconnected in complex ways. Inadequate housing, especially in informal settlements which lack basic infrastructure, leads to unsanitary conditions that worsen health outcomes. Poor access to clean water and sanitation exacerbates poverty by increasing illness and healthcare costs, particularly in substandard housing. Education is also linked into poor water quality and sanitation issues, as children, particularly girls, miss school due to poor sanitation facilities or the responsibility of collecting water, which further limits their economic prospects and perpetuates the cycle of poverty. Community health workers in the WASH program play a critical role in advocating for health equity by firstly collecting data on waterborne diseases, sanitation and living conditions. And this informs policies that can then directly improve water access and housing. Community health workers also collaborate with local governments, schools and NGOs to address interconnected issues like housing, poverty and education. By helping to secure funding for improved water infrastructure and sanitation, community health workers then can enhance living conditions and reduce health burdens. In Kenya, for example, their focused advocacy efforts have successfully led to an almost $1 million commitment towards sanitation and hygiene improvements across the 3 countries. Applying this part of the model to nursing specifically, we can see that nurses can expand on their own roles by using patient data to push for policy change, increased resource allocations, and improvements in living conditions, access to education, and poverty reduction. I actually know personally a nurse who spent an entire day at a veterinarian's office taking care of a homeless man's cats just to help him get his own housing needs sorted out before then she could go on to start addressing his health needs. It's a really potent example of how different kinds of activities can actually improve health. The next component focuses on influencing government policies through evidence-based approaches, scaling up interventions and sharing key knowledge. This map from the Brazil UNICEF Trilateral South-South Cooperation Program shows how health and nutrition programs developed for use in Brazil have been shared and adapted internationally. Actions by community health workers have been used to improve health services and policy adaptation in those partner countries. Like community health workers, nurses can use data, help scale up health interventions, and share knowledge to drive evidence-based policies and improve healthcare outcomes. The third action area is strengthening health service delivery, and we can also link this to the WHO's health system strengthening building blocks. The Kenya WASH program strengthens service delivery through capacity building, training community health workers and local managers to sustainably implement services, particularly in areas affected by waterborne diseases that are currently underserved. The focus on community-level service provision ensures access to clean water and sanitation, while strengthening supply chains can improve the delivery of essential materials at the right time. Likewise, nurses can address upstream determinants of health by advocating for improved transport infrastructure, affordable medicines, universal health coverage, and addressing things like low wages and welfare payments. These factors are really critical to the WHO building blocks. Better roads, transport, advocating for universal healthcare improves health financing, advocating for fair wages and reducing medicine costs enhances access to essential medicines. Critical to this is developing leadership skills among the nursing profession to undertake broader change.
Apologies, Albie.
Okay.
We are nearing time because
That's
sorry
fine.
about that.
I've got one more slide after this.
Yeah.
So the last of those four approaches is the empowering communities, which is all about building local capacity to make health programs sustainable. They focus on promoting social and behavioral change, working with communities to shift health-related norms, like reducing the stigma around mental health and HIV/AIDS. A big part of this is also about generating demand for health services, educating people about their rights and breaking down barriers to access. And these were the boundaries that Professor Chow mentioned earlier. So just to wrap things up, looking at the key implications for nurses when it comes to addressing upstream social determinants of health, advocacy for health and other rights is one of the most powerful roles that nurses can take on. With the data they gather from patients, nurses can advocate for improvements in housing, education, and other policies that address the root causes of poor health. Influencing government policy is another crucial area. By working closely with policymakers, nurses can ensure that health policies are grounded in evidence and address upstream factors. Nurses can play a critical role in strengthening service delivery, advocating for better infrastructure, medical supply chains and broader health coverage. And community empowerment is a really important area where nurses can have a lasting impact. So like community health workers, nurses are often deeply embedded in their communities and can lead initiatives that promote education, economic and social empowerment and leadership. So what I'd like you to take away from this is an awareness of the complex interplay between upstream and downstream factors that influence health. Working upstream can lead to downstream changes, while nurses should be aware that upstream outcomes of their downstream activities and the kinds of actions strategies that nurses might employ in moving their practice upstream. So in this project, what we're really hoping to do is to gather case studies and stories of how nurses have worked with the upstream social determinants of health, consider those complex interplays and develop a set of guidelines that we can use to build our understanding of how we can move our practice upstream. Thank you very much, everyone.
Thank you very much, Dr. Sharp. And everyone, now we will move into a reflective discussion moderated by Dr. Chuti Mohammed. This session will be a little different from the usual panel format, since we want to create a space for a broader conversation, lapping into the expertise and experiences from everyone in the room. And the facilitators for this discussion will be Dr. Natalie Cutler, Dr. Albie Sharp, Professor Chow, Professor Tracy Levitt-Jones, and myself, Priya Sarwanakumar. Please feel free to share your thoughts and experiences in the chat box, as well as using the app. Yes, I'll hand over to Dr. Chuti Mohammed to guide us through this reflective discussion.
Thank you so much, Dr. Priya. That was a wonderful session so far. So just like Priya said, this last session is kind of an open discussion that we particularly want to hear from the audience, the sort of things that kind of motivate you to contribute or take part in this project about critical role of nurses towards the upstream social determinants of health, as well as if there are any ideas that you want to share with us as to how you think we can best implement this project going forward. maybe working in the nursing practice, nursing education, or in the community, we want to really hear about the different experiences that you may have in your area. So before we get into that, there are just a few questions that I think are important, which are addressed to Professor Chow and Professor Tracy. So I will put across these questions, but please have a think about what motivates you, or how do you look at this project going forward from the audience. So I will start with Professor Tracy. One of the questions says, militaries account for 5.5% of greenhouse gases annually, and conflict is impacting people and the planet. What role do you think nurses should play in advocating for demilitarization?
What a fantastic question.
Yeah.
Now, I think in many nursing standards and regulation documents, we talk about the role of advocacy. So often we do not use our advocacy skills or our political skills in activism. And I think we're in a situation with global warfare, climate change, and other wicked problems where we can either step back and say, well, you know, I can't do anything, I don't have the power, or remember that there are nearly 30 million nurses across the world, and our combined power is considerable. And we have to advocate, we have to speak up, we have to be politically active, we need to carefully use our voting privileges to really make a difference. And we have to have conversations at a local level and a broader level, and be informed and make both moral decisions and very informed political decisions.
Lovely. Thank you so much, Professor Tracy. And just now that we are talking related to politics, I would like to pose the next question to Professor Chow. The question says, the geopolitical landscape is currently having a massive impact on human health. What role do you think nurses will play in the political space?
Okay, there are several phases that we have to pay attention. First, that I think we need to educate our all of our nurses that we need to contribute to political discourse by educating the public and policymaker about the importance of healthcare reforms. So that's also educate nurses for their public awareness for that. Second, I think we need to understand right now in Taiwan, many nurses, not many, some nurses may choose to run for political office or participate in governmental roles. Why are we doing that? Because we are using our expertise to make informed decisions on health policies, on public safety, and on our social justice issues. That's why I think this part need to pay more attention on that. Our political leadership and office holding will be another key point that we need to evolving on this part. And the third part will be influence on mental health as well as public health leadership. Those are very critical phases that we need to focus on. Thank you.
Thank you so much. Thank you so much. Yeah, so anyone from the audience, if you can put your hands up so that we can see you. Do you want to share any thoughts so far about some of the issues discussed, or how you envision this project going forward? Anyone from the public, from the audience? Otherwise, I can continue. I still have a few questions on ground.
Can I make a comment? Sorry, Shudi, just about to bad timing. Just a quick comment, which is that the objective of the project that Shudi alluded to, and the initiative that's kicking off today, is to really look at what are the ways that we can strengthen nurses' capacity to influence at the upstream level, and at what points do we intervene. And I think all of the answers have been provided, but the way it fits at the local level or for our individual context might be different. So we want to collect those case studies to find exemplars of how nurses have led the way as inspiration for others and in different settings around the world. So that just gives a bit of context for that comment you made, Shruti.
Lovely, lovely. Thank you so much, Natalie. Priya, your hand is up.
Thank you very much, Dr. Chuti. My question is to both Professor Chow and Professor Tracy. So in this space, what is the role that nursing students, undergraduate nursing students can play? What can they do? Thank you.
Yeah, so can we have Professor Tracy, Professor Chow, anyone who wants to respond to?
All right, I will start.
Lovely.
I think, first of all, nursing students need to be educated about the nature and extent of the problems we're discussing. They need to be empowered so that as both students and as graduates, they can step up and make a difference immediately. I think we've been remit in many nursing programs that we haven't really focused more broadly on public health, on community, on broader issues. I think it's a missed opportunity, and I think we have the responsibility to open our scope so that students are better prepared. You know, just in Australia alone, we have nearly 30,000 graduates every year. Imagine if every one of those were fully prepared to, you know, step up and take on a role in the upstream determinants of health. There is enormous potential. I'll hand over to Dr. Chow now.
Thank you so much, Professor Tracy. Okay. Professor Chow, anything you want to add to?
Yeah, I would like to add something that I think currently our nursing students are outstanding. They can promote public health awareness by their way. They need to, they know how to, you know, participate in community health projects better than us sometimes. So I think the first part of the role, they can promote public health awareness, and also they can integrate with the nursing technology so well, so fast. So that's another role that they can do. And they play a very important role as the forefront of advocating for change as well. And so do not underestimate their role. And they are the learner and also our future for all healthcare providers. So that's their role. Thank you.
Lovely. Thank you so much. So still back to the audience. Anyone with a question or contribution that you want to pass across?
Hello, can I come in?
Yeah, sure, please. You can come in.
Yes. I found the presentation on climate change by the professor very interesting. The poor planning in most of the developing countries is now resulting into perennial flooding, like the one we have in Maiduguri now in Nigeria, Borno State. And that is overstressing the work of the nurses. Right now, most of the health institutions are virtually not working. And that has compounded the disease outcome. So what is the way out? Honestly speaking, the nurses have been overworked, they have been overstressed, and they have been overwhelmed. So that's just my own contribution. So the climate change issue is very critical to nursing, being somebody with a background in geography. So what is the way out? Well, how do we see this issue now? It's all over the place. Picture I saw in Kenya is a very serious one. It's all as a result of poor planning in a way. The houses are not planned well. So we're always going back to square one in terms of what the nurses are doing. Thank you.
Thank you so much. That was Dr. Mustafa from Maiduguri, Nigeria. Thank you. That is really a critical area, and that is the whole point of getting Professor Tracy to give us an overview of how nurses can fit in or contribute to the climate change. So the issue of flooding, as we all know, is everywhere right now. I mean, many countries are affected. So, I mean, this is one of the key areas that we can put effort to see what nurses can do. So any response about this, Professor Tracy? Any comment? about.
Thank you, Judy, and thank you for the question, Mustafa. I completely agree. Across the world, nurses are overstretched and overburdened, working incredibly hard, and it's disproportional because in some countries, as Professor Chow's presentation showed, there are, the ratio of nurses to the population is very disparate across the globe. I guess I would say that despite that, there is something that all of us can do. We don't necessarily have to change the whole landscape of healthcare, but wherever our scope of practice lies, we have the opportunity to influence, the opportunity and the responsibility to influence. And that's a big ask, I'm aware of that. But I think for too long, nurses have said this is a political and environmental issue and I'll stay out of it. We can no longer stay out of it. It is an upstream social determinant of health that we need to address in whatever way we can.
Thank you so much, Professor Tracy. Anyone else from the public, from the audience? Otherwise, I've got a few questions coming up. So one of the questions says, let's name the issue at the top of the stream. Western focus on profit is harming the health of the majority. How can nurses turn social focus to well-being? So anyone? I will read the question again. Western focus on profit is harming the health of the majority. How can nurses turn social focus to well-being?
I just want to say that first of all, yeah, you do have to name what the reality is before you can start to harness any mobility towards changing it. And the collective power of nursing is enormous, and there's some questions that were sitting in the question bank about the models that I presented earlier, and which one did I think was most influential at the upstream level. And to me, there are two models that are really focused on power, and one is power as influence and the other is power as knowing. And so using both of those types of power to almost create a movement, towards change. We have that power, but we just don't necessarily know we have it, or that we don't know how to use it, So I think that conversations like these are really important, and forums like this are really important to have those discussions, even though we can't solve things in a minute, and it's not about being, desolate and losing hope. It's actually the opposite. Yeah, that's my contribution.
Thank you so much, Natalie. Thank you so much. And yeah, we have a question coming from the chat as well about artificial intelligence. And I wonder, Professor Chow, if you have anything to share about technology, particularly artificial intelligence, is influencing practices across professions. How is it influencing nursing practice, considering the role of nurses in the social determinants of health?
Okay. Actually, nursing technology has been, ran so fast. Currently, for example, like the machine learning, and nursing field did not involve a lot of machine learning yet. However, a lot of hospital is trying to engage in the data mining, especially in machine learning. So they are trying to predict for the future risk for hospital. That's how we nurses need to pay attention as well. Those are the technology that all of us need to learn. We can identify some risk behavior or risk related factor. And we do have those kind of data already, but we didn't know how to analyze and predict for future risk behavior for the whole hospital or risk phenomena. So those are one thing that we need to learn by the technology. And for nursing technology, there are so many things. I just identify. At first, there are 8 priorities. It's gonna change our services in the future. The robot, especially for the movement, the robot for the transfer, the robot for data for the toilet. Those are basic robots that can be has already changed a lot. The second part will be the data merge. So we have to gathering the data across the whole world, not just limit to specific hospital. Right now in medicine, it's already merged to a large of biobank. And I believe in nursing, we can merge the data together as well. Those are several cases and several examples that in the future, for the virtual care, for the data mining, for the data searching, and also for the robot, are several branches that's gonna change our life. For nurses, we are not doing those trivial things anymore. Try to believe that. For those, check for those your drugs every day. You don't check by yourself. Let the machine check for yourself. And those are things, it's gonna happen. We need to make regulation to follow those changes as well.
Lovely.
We don't have to check. We don't have to check 5 times whenever we deliver the medicine. We check sometimes periodically, because I do believe technology can share some burden for us physically and mentally. Thank you.
Thank you so much, Professor Chow. And due to the time factor, I will stop here and hand over to Priya to conclude the program. Thank you, Priya.
Thank you very much, Dr. Chuti and Professor Chow and Professor Tracy, and for everyone for their input. Now I've got a request from our project lead, which is really good suggestion for all of us, the participants and the panelists and the team today, to have the cameras on so we can have a group picture to mark today's event before we move into the closing. Thanks, everyone. Dr. Chuti, would you please be able to take a screenshot?
I'm gonna take a sneaky one too.
Yeah, that's good enough.
Yeah, I'll just wait for a few more cameras if people want to turn on. That looks great. Thank you. That's
just one more. 3, 2, 1. Thank you so much.
Thank you, everyone.
All good.
Thank you. Thank you very much. Thank you. Yeah, now I'm going to share my screen again. Please bear with me. Yeah, so please allow me to thank everyone present here, for your wonderful participation, for making this inaugural symposium really a fantastic success. We've had insightful discussions and we've learned from the distinguished professors and the panelists, and also from the input from the audience. We've explored the vital role nurses play and extending to the nursing students as well in influencing the upstream social determinants of health and advancing equitable healthcare globally. Now, I want to just remind you of the case study submissions. So please, follow the link using the QR code here so that you can put in your case study submissions. And as well as I would like you to please put in your thoughts and your posts on the Facebook page that we have created for the initiative. And the last reminder again, I would like to invite everyone to please register for the regional symposia. There are 3 more regional symposia that we do have in November and in December. May I at this moment check with Dr. Cutler and Dr. Shah regarding the dates?
Yep, it's the 1st of November, the 11th of November, and then the 13th of December. So the events are in our website, so you can actually go in and register there and have a look at respective, because they're regional, the time zones are set for the regions that they're going to be held in. So, you know, you have to calculate your own time zone.
Thank you very much, Dr. Cutler. So the first regional symposium will be focusing on the Americas and the Western Europe, and the second regional symposium, Africa and Eastern Europe, and the third regional symposium will have its focus on the Asia Pacific region. Thank you. Dr. Sharp, you wanted to say something?
Yes, I just wanted to reiterate the kind of purpose of what we're trying to do. So what we'd like to do is capture the stories of how and experiences of how health workers around the world, particularly nurses at this stage, have employed the social determinants in their work. And we'd like to share those stories with our growing audience, and we would like to together as a community work on developing a set of best practices and guidelines that we can introduce into nursing schools and share as a kind of professional practice corpus or body of work that we can all learn from. One of the things that we found when we started this project is that there's a big gap between what nursing education offers in terms of the social determinants of health and what we, well, as a profession, I'm not a nurse, I'm a public health scholar, but what is actually employed in the field. So what we're really trying to do is bridge that gap through stories and through experiences. And we'd really love to collaborate with you in doing that. So we hope that you'll continue to be involved throughout each of the regional sessions. Even though they're labeled regional sessions, we want to encourage broad participation from around the world as well. And we really hope that you will continue to be involved as we work through these next steps. So thank you very much, everyone.
Thank you, Dr. Sharp. Now, may I ask, we have collated a lot of questions from the audience today, and we have not been able to address every question that was put to the panelists as well. Dr. Cutler, would you like to let us know how we're going to use them?
Yep. I thought you were going to say, would you like to answer them all right now? No. So yes, I think what I'd really think could be a beautiful thing to do would be to actually bring them together, look at them together, and formulate a collective response that we could post up to our website. So if you have asked a question there, we would love to respond to it, but we'll do a little bit of work around that. And so keep an eye on the website to see how we present that back to you with our responses.
Thank you. Thank you very much for everybody, for the organizing committee, for the members of the initiative, and for the participants, and for our esteemed speakers. Thank you very much. Please do stay in touch and feel free to reach out regarding the initiative. And we'll keep everything updated on the social media pages as well as on the website as well. Once again, thanks everyone for your time, energy, and commitment to advancing the global health through nursing. We look forward to seeing you all at our next regional symposium.
And thank you, Priya.
Thank you. Thank you.
All the best. Bye-bye.
Thank you, Priya. Bye, everyone.
Thank you.